今天是4月29号，我跟妈妈来 Kaiser Sunset 4900 Sixth Street 来看她左边的耳朵，妈妈耳朵痛，已经3个礼拜了，吞口水也痛，
脖子转弯也痛，
脖子转弯也痛，
吃东西也痛，
吃东西也痛，吃东西不能吃太硬，只能吃软软的东西。哦，
Say ah. And relax. Relax. I'm gonna take a. Everything's looking okay. Turn this way. How often are you using the drops?
Every 4 hours.
Every 4 hours.
4 drops and then
Ciprodex?
Yeah, that one is I think vitamin C. Every 8 hours I do every 8 hours.
You're doing great. Great job. Hang it. You're doing a great job.
Is that possible?
You just have a lot of earwax. I know. You're doing great. These Q-tips, the earwax gets really packed on the inside.
哦，
Doing great. This side looks fine.
哦，
Anybody ever told you about do you have issues with your joints?
Huh?
Joints? at
joints? No,
all? You don't have any joint issues, right?
no.
Problem with joint, no.
So the TMJ is the jaw joint. The jaw joint is right in front of the ear.
Mhm.
When you move your mouth, every time you move your mouth, you chew, sometimes when you swallow, you move this joint and that's causing pain. Now this joint lies right in front of the ear canal.
Mhm.
Whenever this jaw joint moves, it's touching on the ear canal and that's why you're having pain on the inside of the ear. But the real issue,
But not this side.
yeah, and not on that side. But
Only this side.
joint issue.
Look like I had something Inside.
The inside of the ear just had some wax. I cleaned the wax out, but the ear looks good. There's no infection of the ear.
No. Even outside here, the whole thing
Yeah.
here.
So even on the outside, on the inside of the ear, the outside of the ear, other than some wax, there's no infection. But what you're having is you're having inflammation, and over time, the joint starts to degrade a little bit, you know, but that joint is causing you a lot of pain and issues. Now, this jaw joint sometimes the pain will spread. So sometimes patients will say, hey, it's not just my ear. I'm having a little bit of pain up here. I'm having pain down here. It's all on this side, and it's because that jaw joint causes referred pain locally. So you're having a lot of issues here because of that jaw joint inflammation. Okay. Now there's a couple things that we do for TMJ.
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 What's that stand for?
It's a long word.
Oh, got it.
Temporal mandibular joint.
Okay.
So temple mandible joint.
Oh,
TMJ.
okay.
But look up I'll give you some resources. Look up TMJ online. But really, how we treat TMJ is nothing, no procedures, nothing like that. But for you, it's gonna be soft diet.
Oh, soft diet.
Yeah, don't be chewing too much. The more that you chew, the more you inflame this joint. So just keep it soft, at least for the beginning here, and then you can start to eat, more regularly once the pain gets better. But a soft diet. It's also do you take ibuprofen at all? Ibuprofen or Motrin?
She can.
Aspirin, 81 milligrams.
Yeah, I would rather have you take ibuprofen or Motrin.
Okay.
Because that will decrease the inflammation here a little better. Okay, so take ibuprofen or Motrin. Take a make sure that you are resting this joint.
Okay, resting.
You can use a little bit of hot pack. If you take a little towel, put it in the microwave for 20-30 seconds and lay it on here, that can help with the pain. But also, the big thing is going to be if this doesn't get better, physical therapy, because they will do jaw exercises with you. Okay, so physical therapy can help, and also make sure that I notice you have dentures. Make sure that those are just fitting well.
Okay.
If the dentures are not fitting well, then you can have some issues with pain. It only started up in the last 3 weeks.
Yeah, she said something popped.
Yeah, so sometimes if you hear a pop,
that
could be because of the joint right there. The joint is right by the
after pop,
ear canal.
I hear the pop and then I lost my hearing.
But how's your hearing now?
Still same thing.
Still
Look
a little
like
down?
somebody cover my ear.
Feels like somebody's covering your ear?
Yeah.
Let me take another look there. Maybe there's something else that I can clean out. But I think your big issue right now is TMJ. Just because it's right here, right?
Yeah, and right here.
And right down here.
And down here.
Yeah, that's TMJ.
Oh yeah, TMJ.
That's TMJ.
But she used to be able to hear well. Now when I talk to her, I have to scream and yell.
Let me see. Let's see if there's anything else I can clean out. Because you had a lot of wax there. And I think that the wax was causing your issues.
But she was able to hear from me before. I don't know.
So I don't know if
maybe
she popped because of the joint, was having pain with the joint, started using Q-tips, started pushing the wax in deeper and deeper,
and then she
causing
can't hear.
issues with hearing.
Gotcha.
Yeah.
Okay.
I think ultimately that's what was going on here.
So even I push like this.
Yes, that is the joint.
Oh yeah?
That is the TMJ joint. Does that make sense?
Yeah, makes sense.
There's still a little bit here that I can take out. I didn't want to make it too uncomfortable for you, but I can take more of this wax out. I know, you're doing great. Okay, you're okay. Great job. Hang in there. Everything's ready. Almost done, okay? I want you to stop using the drops.
Oh.